Thank you, Leah. Just give a moment to share my screen. Here it is. Okay. Thank you very much for the invitation. I would like to thank Lydia Ma and Leah for the introducing me. I'm really pleased here to present you the Quebec, our recent work on Quebec health alert systems, focusing on cold events. As you can see, this is teamwork with a number of people from INRS, where am I, from Public Health Institute in Quebec, Institut National de Santé Publique, INSPQ, and from Health Canada. So the outline of my presentation, so I will start from the beginning to present the context, the general and context, what is climate and health, what is the connection between them, and then to present the alert systems. And then I go back to the specifically to cold and health. Then I will present our approach with the cold system. I will present at the same time the method and with the results from the application in data with from Quebec, the province of Quebec. Then very quickly and briefly, I will present the other systems that we have developed, for example, the one with air pollution. And I conclude with some conclusions and some thoughts. So let's start by the first point. So when we think about climate change, usually we think about their effects, and their effects can be on a variety of sectors: agriculture, health, biodiversity, and tourism, and a lot of sectors. And here we are interested in the health part. And inside the health, there is another number of effects of climate change. Depending on the issues like respiratory illness, or infections, cardiovascular disease, and mortality, and there is a lot of impacts. Now, regarding the extreme events, they have very important effects on health populations. And we start studying this effect, and it starts to attract attention of the researchers and even the media and the populations in the Western Europe heat waves in 2003, where there's really huge heat events, where there's more than 70,000 excess deaths. It's a huge numbers. And for example, in Quebec in 2010, we had heat waves where we had more than 300 deaths related to heat. And the recent ones, we have already getting this in British Columbia, in your province. We had in the last summer, there's more than 500 deaths. And I remember this, they were talking about this in the Globe and Mail, very interesting and detailed report. They go beyond the numbers. When you read this paper, this report, it's really interesting, and they you feel it. You feel what this number means. And I was interviewed by the journalist Catherine Baum, and they invite you to read this very interesting report, Globe and Mail. And heat usually had an import stress, for example, among other problems, on the cardiovascular system. I will not go in details in this. We can see the same effects also, or other kind of effects coming from smoke, from air pollution. And this is usually for large cities. For example, in Canada, it can be the Toronto or Montreal, or Vancouver, for example, and it can comes from cars or from forest fires, and mainly it affects respiratory diseases. But when it comes to cold, we have only a recent study, not a lot of studies, and We have always in Canada and in Quebec, because we are a northern country, this winter in last January, we have a very cold January. Sometimes it's -20, -30, a very good, very cold month. And at least we can see in the media that we're talking about 2 homeless died in Montreal. And in Canada, in general, when we talk about these connections between health and environment, we are lucky to have this report released last week from Health Canada, which entitled "Health of Canadians in a Changing Climate." It's a very big report. I think in the French version is about more than 800 pages with a lot of details and a lot of updated references. So I invite you to read, to have a look at this report to get more details about this connection between environment and health in general. And when we talk about health and climate in general, there is some objective, what we want to study. The first thing which comes to mind is to study the relationship between weather or environment variables and health variables. The input variables that could be temperature, precipitation, humidity, and so on. And the output variables of interest could be mortality, hospitalization in general, or farm-specific diseases. And this is we are interested in to see this relationship. The goal is to understand when we see and we understand this relationship, we can make actions, we can help public health authorities to understand it. For example, we know that the relationship is not linear. Like some forms, like U form, there's at the beginning effect, but in the end, in the extremes, but in the middle there is what we call it a comfort effect. There is not a problem when in the middle. Another topic which is of interest also is to study the issue alerts to the vulnerable populations. And this is not it can be the relationship can be helpful for the alerts to understand them and to identify to issue the alerts. And the alerts are punctual and they are helpful to make decisions prior or some events, specific events, and help public health policies. There are also other topics, not only relationships or alerts. For example, how to manage the neighborhood developments. For example, if we have new developments in the city, how to make the green area or green roofs or with air conditions, and all these things are important to study. There are a lot of other topics also we can study when it comes to health and environment. In this talk, we focus on alert systems. As I mentioned before, here we are, we want to study health and climate. We focus here on warning system or alert system if you want. There is heat systems and there is cold systems. The heat systems are very well developed and we can say they are well established. For example, we can see in France, we have this paper in 2005, and we have another one in 2004, and ours in Quebec in 2013. But when it comes to cold, this is our topic here. We are in the warning systems in cold. It's a new one, and it's the same thing. It has the same goals. Like heat it means to monitor environment wave events and to launch alerts to reduce their effect. The goal is really to these systems is to reduce their effect. For example, when now regarding these systems, several countries, since the heat waves in Europe in 2003, several countries developed their own systems in many regions, especially in Europe and in North America. There is a lot, variety of systems. There are some local systems, like for Toronto or Roma. There is others which cover like the province or national-wide, like in France or in Quebec. Regarding smoke, also there is a number of systems, and they are well known, for example, by Environment Canada and or the World Health Organizations. And also there is a lot of systems in China. I have to mention here that when you talk about warning systems, there is a lot of steps and a lot of it's a part of all these steps. We can it's only by launching the alerts or it's a computation system. Computation is a lot of parts. For example, we evaluate here the heat thresholds, and we have the warning step, and then we have the communication step, which is very important, how to communicate the alerts to all people or to only in the media, or how to communicate it. And after this, we need to decision maker. They have to make actions and to make decisions. And after the event, we can come back and to evaluate the whole thing. They evaluate our how the actions, the decision, how it was the decisions, and all the things to be evaluated. So one question is, one can ask, I have been asking this question me when I start working on these systems, is, and it has also asked by the media when I have the interviews with different media, is why we are developing such systems? Because we have other systems. For example, there's by Environment Canada, or when we see in the media, like I have the picture here from the Weather Channel, we see this kind of alerts and systems. So why we are developing new ones and health environment systems? So the difference is the health environment systems, they are health oriented. They really dedicated a focus on health. And they integrate health issues, especially in terms of data, in their design. When we design these systems, health and environment systems, we consider health data. And these systems, health systems, are not issued directly to the media or to the general population, which is not the case for the Environment Canada, for example. Alerts, we see them in the media and for all the population. When it comes the systems for health environment, they are not directly to the media, but to the authorities. These health environment systems are designed for public health authorities to make decisions, for example, to how to manage the hospitals and how to manage the personnel and so on. And also maybe used to target subpopulations. For example, if we see that the effect may be on the elderly, so we can target this subpopulation directly. We don't need to alert the whole population. And also the health environment systems, they have the ability, and they are designed also to respect administrative limits or geographic limits of the public health authority. On the other side, the weather alerts, what we see in the media in general, they are general, or if I can say, are generic. They are designed to cover all sectors, for example, transportation, tourism, including health. And they are for general population. They are not for specific population. The other important point here is that these systems don't consider health variables directly or in their design. And they don't consider geographic limits of health regions, because we know, for example, Quebec is divided in a number of administrative health regions. For example, Environment Canada, they don't consider this division. But I have to say that the forecasting provided by the corresponding institutions are very important and are essential for health environment systems. For example, Environment Canada, they issue their alerts, but also they provide forecasting for the next few days, for example, for temperature. We use this forecasting for as input for environment systems. I hope this point is important because we are it convinces you that it's important to develop health environment systems specifically for health. Now I get back to cold because this is our topic. I was explaining the health environment in general and health environment alerts and systems. Now, specifically on cold, I was surprised to see in the report in Health Canada 2022, released last week, there is a whole section dedicated to cold. And they detailed all this the information. I take some elements from there, and they say, for example, the cold is known to increase the risk of cardiovascular disease, respiratory disease, and stroke-related illness and mortality. They give some examples, like, for example, people with pre-existing problematics like kidney and cardiac conditions, they have a higher probability of being admitted to emergency department compared to general populations when there is extreme cold event. Okay. There is also intense cold periods can affect the volume of emergency department visits at least 1 week. So all these points, there is some studies regarding this. If you want the details, I invite you to go to the report of Health Canada. They give these details when you talk in general about health and cold. For sure, cold is not studied as much as heat, but it's also important. Also, when the particularity of cold. For example, schools can close in extreme cold as a part of the efforts to keep students safe for their safety, and also homeless. They are experiencing really are very exposed to cold. As I give the introduction, in Montreal this winter we have 2 homeless died, unfortunately, because of cold. For example, there is in France, which is not as cold as in Canada and Quebec, and they said that 72% of people admitted to the emergency department for hypothermia or frostbite in some winters, they are from 62%. They are from homeless. And also, the particularity of cold is the duration of the exposure is not very well known as in heat, and usually it is longer. It can be up to 2 weeks, or sometimes it can be longer. In Nordic regions like ours, like in Canada, like in Quebec, mortality is generally higher during winter than the rest of the year, especially in summer. So this is the differences between cold and heat. In terms of mortality, it's higher. When we talk about warning systems, heat. We have a lot of the systems developed, but not for cold, and especially for Canadian winters. We don't have these systems. In the literature, at the time we published our work, we find there is only two systems, one in UK and another one in Macedonia, regarding cold, two systems for cold. But when you look in the details, there is some limitations for these systems, especially they are based on mean temperature, and we know that the mean temperature is not harmful. The extremes that are harmful, and UK and Macedonia, they are not Nordic countries. So it's not really dedicated specific to countries like ours, and they are not specific to cold. They don't they include cold, but they are not only for cold. So they include it in the whole year. So all this to convince you and help you to that the importance and the usefulness of to develop a cold system to mitigate the associated impacts, and especially for countries like Canada and provinces like Quebec or BC to develop this kind of systems. Now, maybe you are asking yourself, what is system? What is a system warning system, health warning system? Basically, and to go there briefly, there is two main components. The first one is we need to have climate indicators. I mean, indicators, we don't use the variable directly. We need the indicators to summarize the climate, and we need to have thresholds. And when once the indicator exceed the threshold, we launch the alert, as you can see here. I mean here indicators, not only one indicator. There can be several indicators. Okay, not only one. So this is very simple presentation of a warning system. So we see we need indicators and we need a threshold. I give an example here of the system we have for heat and mortality in Quebec. We have been used since 2010. And this system, they showed their usefulness and effectiveness. Even there is other studies to check and to evaluate the performance of the system after the heat waves of 2010, and they show it's very important system. And another studies, they show that the mortality is reduced. I don't remember exactly the numbers, but it's reducing since we established this system. So the system is like a weighted mean of 3 days of heat. This is the case of Montreal. And if the maximum temperature over these 3 days exceeds 33, and at the same time, the minimum mean over 3 days exceeds 20, both when we exceed both thresholds, minimum and maximum, then we launch the alert. This is how the system is designed. The system is implemented. This is the threshold and the indicators, and it's implemented in what they call Supreme in Quebec, and ENSPQ. They developed this real-time surveillance and prevention of the impact of extreme meteo events. They call it Supreme. It's integrated there, and it's used since 2010. I showed you only the example of Montreal area, but we covered the whole province in different regions. So you see the red one here, the small one is Montreal and Laval, and all the other regions. Okay. I will not go through the numbers here, but to show you that we have this system to cover the whole province, and not only by cities, but the whole. Now that we go to our proposed system for cold, I will not will present the method, and at the same time, each step I present the results for Quebec, the data of Quebec. So the proposed system is inspired by the one we developed in for heat. Because remember, we developed the for heat in 2010 and published in 2013, We inspired by this to develop the one for cold. But it's not as simple as it is. It's not like having the same number and the symmetry, like multiplying by minus and you have the other side. It's not as simple like this. And also we take this opportunity to improve the heat system in terms of methodology. I will show you this later. It's also important to show the difference between heat and cold. It's not like only minus. You have some numbers and you multiply by minus, you have the other. There is some different. One of them is the lag. Heat, the effect is relatively short. We're talking about few days, usually 3 days, and it's very well studied. However, for cold, it's generally much longer. We are talking about weeks, in general 2 weeks, and there is not a lot of studies for cold effect. The other thing also here, because we are talking about cold, we find that it's important to study and to develop 2 systems. One system for mortality and another one for hospitalizations. There is really difference between them. And I remind you here that for heat, as far as we know, all the other studies for heat, all the systems, they are based only on mortality. So this is one of the novelty here. We have the 2 systems, one for mortality and another one for hospitalization. Maybe it's not important for heat in summer to develop for hospitalizations, but for cold it's important, and we see the difference in the results. We can see also later that the cold effect on mortality and hospitalization is different. For example, over mortality and over hospitalizations, they don't occur at the same time. Maybe there is a lag between them, and they don't have the same amplitude. The data we used to develop our system is from the whole province of Quebec, except the very far regions where there is no population. So we have now 16 what we call RSS, which is basically health regions. And we cover winter from early December to late March of over more than 20 years. We use data, death and hospitalization, daily data. The same scale, data for weather variables, temperature, mean, max, and mean, wind speed, and the vapor pressure, which is like humidity. We used, except for wind speed, we used the DayMet databases, which is developed by NASA. It is like an interpolation, extrapolation to cover all the North America with a grid 1 kilometer square. It is very important for this kind of results of this kind of study. Why? Because we are using data. It allows us to be sure to have climate data close to population, because in some regions we have data in the station is in the forest, so it's not really representative. With this, the DayMet, it's more appropriate to cover the regions where there is population. As you can see here, the red regions, what we call Ecoman, this is where population is, and the white, there is no population living there. But that could be some stations, climate, weather, meteor station there. I'm giving you here like an overview of the methodology, very quickly, to have in one page, in one slide, to have all the methodology. So step 0, we group the regions, the health regions. If you work with one region or one city, you don't need this step. But if you want to cover like a large territory, for like over a province or over a country, you need, maybe it's useful this step. And for each region or each city, you need, the first step is to lag selection. It means also the indicator definition. And this is a new part for cold. When we work on the heat, the lag is like easy to identify. It's clear. The majority of studies, they use 3 days, but for cold, we don't know it. So here we developed a method to define it more objectively. The second step is to evaluate the over mortality and over threshold, associated over threshold. The over mortality or over hospitalization is because we always have mortality or hospitalization. What we are interested in is the over one, what is not expected, is higher than what is expected. And here we introduced the spline method to evaluate this over mortality, which is more accurate and more realistic. In the existing approaches, in the previous approaches, they use like the average window mean, which is not really, it's not realistic. The third step, we evaluate and we identify the episodes where there is a problematic of cold. And here we use only preliminary thresholds, they are not final. And then the last step, with here we have the optimization. We run the calculation a lot of times over the different preliminary thresholds and a lot of indicators to find the final appropriate indicators and threshold. So I give it very quickly here. In the next slides, I give the details, but maybe I will not have time to go through the details. But I will, because the slides are, I will let them in the online, so you can get through them if you want. So I will get very quickly here in the next slides. So what I will explain that we cover all the region or Quebec, so we need to make a clustering because we have some regions there is not enough population. The result of this step gives like 4 classes, as we can see them here, and we check them with the climate map of Quebec, and they agree with between both clustering. There is a good agreement between them, so we accept this this clustering. There is a lot of details here regarding this clustering. If you want, you can see the paper or the details later. For the lag selection, here I remind you that the indicator is like combination, linear combination. Here L is the lag, that means we go back a number of days and we multiply for example, here the temperature maximum by a coefficient to obtain the indicator. The method is to find this lag because it's now not known and we don't know how it is, and especially for the case of cold, it's very large. We use what we call distributed lag nonlinear model, DLNM. The result here is this this kind of curves, and when we make slides, we can see here the suggested lag is 4 days. So the 4 days is obtained by the is evaluated. It's not like for heat. It was like selected a priori based on other studies. We said, okay, the effect is 2 or 3 days. We take 2 days, but here is evaluated, and we can find L is 4 days. The lag is 4 days because you see here the risk is significant. And hopefully for our case here is the same for Tmax and Tmean, but it's not always the same situation. Here in the over mortality or over hospitality, you see here the red lines here. In the previous studies, including the heat one, it was like a straight line, which is not realistic. Here it's like it follows the data. It's more representative. I will not go in the details here. Another thing here is, no, I will not go in the details. Here, step 3, how to select the events an event is selected if the hospitalization or mortality exceeds its threshold, and also the temperature is less than the threshold, and the same thing for the T-mean. I highlighted this less because we are maybe used to the heat is more than, is bigger than. Here is less than, because we are on the other side. The same thing here is hospitalization. I will not get through it. And now when we have the events, now the last step is the optimization. When we need optimization over the indicators, the lag is well identified. We need criteria, because optimization according to a criteria. The criteria is the sensitivity and the number of false alarms. We want the sensitivity to be the highest and the number of false alarms to be the lowest. I give you here an example of the once we run this optimization for Montreal and region and mortality. We have 4 episodes, and these are the optimal weights. By chance, we have it's the mean. It's only by chance. It's the really optimal, and here are the thresholds. For the maximum over 2 days, it would be less than -15. For the minimum temperature over 2 days, the minimum should be -23. And we have very good sensitivity, have 100%. And we have like less than 1 false alarm per year, which is very good. This is only for Montreal, but we applied for the all other regions. I will not go through the numbers here, but usually we see the weights here. The only situation here is like class 3. We don't have always the mean. It's the weighted mean here. Are giving more weight the first day, and the numbers here are very big here. -20 the minimum, the maximum, and -29 as the maximum. Okay. This is for hospitalizations. This one is for mortality, and this one for hospitalization. For sure, for comparison purposes, it's better to see them at the same time. So the orange one is mortality, and the purple is hospitalization. I see here there is a lot of numbers. We cannot get through them. But let's take, for example, the class 1 Montreal. We see there is some differences between mortality and hospitalization in terms of the episodes, the number of episodes, in terms of the indicator, it's not the same one, and also the thresholds. There is some difference between them, and also in the performance. We see, for example, there is a lot of things we can see here. For example, the performance is a little bit reduced in the northern regions, like the yellow one and the green one. In the Quebec city and the blue one and the red one, Montreal city, the performance are quite good. There is another question what we have been asked is we can think about it is the confounder, because we are in winter. What about the influenza? Maybe these deaths or the hospitalizations, they are affected by influenza and viral pneumonia. We did this study to check if what's happened and what is the sensitivity of our results, and we find that there is no effect. There is very little effect for class 3 in terms of the episodes. There is 2 more episodes, but the final results are exactly the same in terms of the thresholds and the indicators. So there is no, for our results here for Quebec, there is no effect of influenza and no. So I hope now it's clear for you the cold system. Now I get very quickly. I don't, on purpose, I don't want to go in the details, but the details are here if you want in the questions, or I can get them later. I will give you now very quickly introduction to other systems. We developed a warning system for air pollution. Because why we develop it? Because the existing air pollution systems, they are like generic. They are not specific to health. They are not local for each a given city or a given local population. And we, because we are talking about air pollution, so we targeted large cities. Here is Montreal and Quebec City, and the effect in summer and winter is not the same, and it doesn't involve the same variables as well. So basically, it's the same methodology, but not the same variables. Here we have and the particles, and is the OX, which is a combination of ozone and NO2. Okay. And the main difference is there is a more performance in Montreal than in Quebec City. Maybe because Montreal is larger, is maybe polluted. We have more data, more events than Quebec City. There is another point here, a system I want to share with you here. You see the previous systems, even for heat or even for cold, we have the same threshold over the whole season. And the other thing also, because of climate change, where the seasons are changing, are moving. Maybe the season is, now we have the summer season is from May, or let's say May or June to September. And sometimes we have very warm or heat in October, and maybe in April. So this is one reason. The other reason also, there is what we call it the acclimatation. There's it means what are not expected. The body is not expected some temperature if it is high in April or in October. So people are not prepared to receive this temperature. So this is the reason it's important to extend the season. But by extending the season, it's not reasonable to keep the same threshold over this extended season. This is why it's more appropriate to have extended season, yes, but evolving thresholds. This is only like an illustration. The up is what we have now, is system, and the down at the bottom is the system we propose with monthly thresholds for a maximum and the minimum. Okay. The results are here very quickly. Per month, as you see here, we have an indicator per month, and we have the thresholds per month. But it's one system. I like this picture because it's not done by myself. It's based on our results, but it's done by one of the journalists in Meteo Media. When we was had the interview, I liked it. It's very well done. So I presented it here. So we see exactly here that the thresholds is evolving through the season, and the season is large here, starting from early April until October. Now I am going to conclude. So the present study proposed, we've considered we are not done with cold. We're just starting to study cold, and it's based on what we developed on heat. We improved some methodological aspect in this method. We cover this study don't cover only large cities, but cover also regions by adding the step of clustering. And the threshold for hospitalizations, we find that they are higher than those of mortality. We find that the confounding variables don't have effect for our study here. The methodology is general and flexible. That means it can be applied to other provinces or cities over Canada or in the other northern countries. There is some thoughts here beyond the results and beyond the numbers. I think that the system is recently developed, but maybe it needs some local and on the ground testing to check by people on the public health if it is maybe required some adjustments before implementation. These thresholds can be also used as guidelines to have an idea for situations where we don't have enough data. For example, if we want to have thresholds for homelessness or for school closures, for sure we don't have enough data to develop systems specifically for these situations, but we can use ours as basic thresholds. These the thresholds are applied to mortality and hospitalizations, but they don't apply for acute cold risks or such as frostbite. Maybe you can think that in the future temperature will warm up, but this depends on the scenario, climate scenarios. But there will be always at least fewer cold snaps, and there will always need of this system. Especially in Canada, we are Nordic country. There will be always hard winters, and cold mortalities will remain higher compared to heat mortalities, even though it will be less in the future. Okay. I want to give you this picture. It's very important because to give you a very big overview where we are, how it works. What we present today is the system design. We define the indicators and the thresholds. And when it needs to be implemented in the Supreme system, which is automatic. And this Supreme system, it have inputs from temperature forecasting, it comes from environment kind of, for example. The design, we do it one time, for example, one time every 5 years or 10 years. But the temperature forecasting, it will be at least daily, it can be even hourly. Once we have the thresholds, the Supreme compute use the forecast and make the computations. And if we exceed the thresholds, they notify the authorities, public health regional directions in Quebec, for example. And this the decision maker, they can make decisions and make actions. For example, for public, with the target public, for municipalities, for hospitals, and so on. And here it's one time, and this is daily, and the Supreme sends the notifications only when the thresholds are exceeded. This is already done for the heat, and we expect, and it's easy to do the same thing for cold. If you want, I remind you here what we had, the final results we obtained for our cold system. And these are some resources I'm giving you here. The first one as codes, if you want to implement, if you want to use in your data, they are developed our former student and postdoc Pierre Maslow. Is there in his GitHub, and give here some papers. The one is on cold and the Health Canada report and so on. And I like always to close with this citation. I replaced models by warning systems, which I like maps. They are never final, never complete until they grow, and because they represent complex reality. Thank you so much for your attention, and for a question, please. Thank you. I have to mention here that I hope that my colleagues Céline Campagna and my student Bixun, they are here to reply some questions maybe if I can't. Thank you.
Thank you so much, Dr. Chebana. We really appreciate you coming to talk to us about your work on extreme cold and alert systems. I'll just ask you to stop sharing your screen